Homosexuality is a complex subject. Last week we spoke to Anand Zadane, where he really spoke about coming out to himself first. Now, to get another perspective, we are now joined by psychiatrist Dr Kersi B Chavda from Hinduja Hospital in Mumbai. Thank you very much for joining us, Doc.
Thank you for having me.
Now, as a psychiatrist and representative of the Indian Psychiatric Society, that is the IPS, what is your stand in support of the LGBTQ community and against conversion therapy?
Since quite a while, the Indian Psychiatric Society has been very categorical about the fact that conversion therapy is not acceptable. It is no longer considered to be treatment in terms of anything related to LGBT. We are very categorical about the fact that this should not be happening. Since quite a while, the Indian Psychiatric Society has come about with a position statement which states that homosexuality or lesbianism or bisexuality is just a variation. It's not a disease, it's not a disorder, it's a variation. Hence, we no longer look at it as a disorder or a disease. So if a person comes up to me, he will come up to me not because he's part of the community, but because he's depressed and anxious, and simultaneously is part of the community. So we deal with the depression and the anxiety and whatever else. We don't deal with the fact that he's part of this community.
Doc, can you take us through the complexity of really confronting one's homosexuality?
I guess most of us grow up in a family where homosexuality is not really discussed. I mean, how many of us would at the breakfast table talk about things like homosexuality and lesbianism? It's not very, very common. While we're in our teenage or even before that, we start getting attracted sexually towards people, and then suddenly when you start realizing that you're getting extremely attracted towards people of the same sex, it kind of makes you wonder what on earth is happening. You get scared, you get anxious, you try to deny all of this. Sometimes you even go out with people of the opposite sex just to prove a point to yourself. So this internalized homophobia is a very, very big thing. And very often we talk about the fact that it's necessary for us to accept our own sexual orientation rather than expect people from the outside to accept it first.
Doc, what is your perspective on the coming out process itself? If a person is not comfortable coming out, that's fine too, right?
This whole thing of coming out has been overhyped. I think it's much more important for you to actually come out to yourself. So you have to accept yourself. Beyond that, whether you want to tell your friends or you don't want to tell your friends, you want to tell some of your family or you don't, you want to tell the whole world, it's totally up to you, and you should not feel pressurized to come out in a sense to anybody. You have to be comfortable with your own orientation, and you have to be comfortable with whether or not you want to come out to somebody.
You know, Anand in his interview also talked about porn becoming the point of reference for actually confirming your sexual orientation. Do you want to tell us a little bit more about that?
A lot of people have talked about that. What usually happens is, especially in the teenage time when you're on porn, and most of our teenagers do get onto porn sometime or the other, they suddenly start realizing that they're more attracted by the sexual activities of the person of the same sex rather than the opposite one, which kind of makes them very uneasy initially. And then over a period of time, they feel very guilty, but they keep finding that it's necessary for them to get onto, porn of the same sex or whatever. And then they start wondering what is happening, and then over a period of time, it becomes more and more clear to them that their sexual arousal is more when they're watching same-sex activity rather than heterosexual activity.
So many people talk about trying to fit into the heteronormative setup and pretending to like someone of the opposite sex like Anant did, right? What effect can that have on someone's emotional and mental health?
Well, I guess all of us actually pass through this thing of not wanting to tell people that we are different. So we call it a variation, but there are not too many of us who would like to go around very proudly strutting around telling everybody that we are different in our sexual orientation. So at least initially, a lot of people try to fit in with the heterosexual norm because that is considered to be the norm. And some of them are even able to perform sexually, but they don't enjoy what they're doing. They feel this enormous guilt which keeps building up. A lot of people get into panic attacks. A lot of people feel very depressed. There's a lot of anxiety. Very often people take recourse to substances in order to numb the fact that they're not being true to themselves. Very recently, that person in America who had started this conversion therapy stuff actually came out 3-4 weeks ago and he proclaimed to the world that even though he went around telling everybody that you can change the sexual orientation through some spiritual and other conversion techniques, he himself was gay.
One of the things that came out of the interview was also this deep-rooted fear of sex as a homosexual. What advice would you have for someone struggling right now?
Well, I think it's extremely important for all of us to be comfortable with our own pace. Just like if you are heterosexual, it's not necessary that you have to jump into bed with every woman you meet. If you feel you're gay, you don't necessarily have to go the whole hog right in the beginning. Take it at your own pace, be comfortable with what you're doing, find out what you enjoy doing, what turns you on, how much you want to go ahead, rather than follow some kind of dossier or things which are written down in a book. Eventually, you're the most important person in this whole thing, and your partner, and it's imperative for you to understand that what is good for you, what works for you, may not work for somebody else. And you are unique in that, and you have the right to be unique in that. So do just what you want to do, and as far as you want to do it.
Now, one other thing, Doc, many people who have struggled with sexual orientation have also battled bipolar, depression. Is there a link, or should depression, bipolar, anxiety and suicidal thoughts be treated separately?
They certainly have to be treated separately. Just like your heterosexual person might have all of these disorders, so also a gay person or a bisexual person or a transgender might have this. The incidence of certain psychological disorders may be a little elevated in this group. For example, you might be more depressed because you haven't been able to come out and you feel guilty and so on. But the bottom line is, we don't treat the person, we treat his disorder, which is a psychological disorder, and not the fact that he is gay or bisexual or transgender.
Do you have a message for someone who's currently struggling with his sexuality, with being an LGBTQ?
I think the most important thing is, over a period of time, learn to accept yourself and love yourself. You haven't done and you haven't not done anything to change your orientation. You're born with it. Over a period of time, hopefully you will find a partner who you'll be able to have a good relationship with. The norms of society are changing fairly rapidly, though there's still a long way to go. We would hope that you would be happy whatever be your orientation, and you certainly should not allow anybody to do any kind of conversion therapy on you.
And a message for parents who may suspect that their child is LGBTQ.
I think the most important thing that parents need to realize is that it's not that they have done or they haven't done anything and hence their child is a member of this community. I think it's essential for us to believe that everybody who is a human being deserves to be loved and cherished and cared for. And just because your child belongs to this community, it should not mean that you should shun him or be ashamed of him or get angry with him or do the other things that sometimes parents land up doing. So support him to the utmost. It is essential for every person to believe that his parents care for him, and it is even more essential for him because he's going to be facing up to a lot of negativity from the outside world, to know that his parents are always there to support him and he can turn to them for help and support.
Well, thank you very much for joining us all the way from Bombay. Dr. Chavda,
Thank you.
It was a pleasure having you on Zen-Brain.